together. You know, the holidays are right around the corner, and we know that food is a big part of the celebration. You want it to taste good, but you also want it to be good for your body. Here's the thing. Do you think about allergies, what you might be allergic to versus what you might be intolerant to, or the folks who are around you? So joining us this morning is Dr. Gill Hart. She's a specialist when it comes to food intolerances at the YorkTest's Center. Dr. Hart, good morning to you. This is such an interesting topic because I feel like a lot of people have varying degrees. So can you first of all explain to us the difference between a food intolerance versus an allergy?
Yeah, hi Gina, thank you. It's a really interesting question because so many people are confused about the differences between allergies and intolerances. Food allergies are the immediate reaction that you get to a food, very severe often, can cause something called anaphylaxis, which is potentially life-threatening. It's when people react very strongly to foods, and we often associate those foods with things like peanuts or things like milk or shellfish. And other foods like that. And, it can be very severe reactions. Food intolerances are very different. They come on very slowly. They're not life-threatening, but they can be very impactful for people because they can cause things like IBS, things like low energy. A lot of people have food intolerances and food sensitivities without actually realising they've got them. They think it's normal for them to feel so tired, and it's not until they get a test or change the diet then they can actually work out what's going on for them.
Well, and that's an interesting point. So if you have IBS, maybe you have some kind of a rash or maybe like an eczema, how do you tell that those are from a food intolerance versus something else?
Yeah, so if it's a food allergy, then you probably know about it because you're going to have those severe reactions. A food allergy is going to cause, maybe swelling in the mouth or, a big reaction like that. In terms of a food intolerance, or it's often called a food sensitivity, people sometimes try and guess which food might be causing them a problem. And that's quite hard because often there are a number of foods involved. It's not like an allergy where there's just one or two. There's normally quite a few foods involved. So people often take an IgG test, a food-specific IgG test, which is where YorkTest comes in because we've pioneered this, over the last 30 years or so. And so people can actually find out then from the test exactly which foods that they're reacting to and then actually manage their diet accordingly. And it takes guessing out of it.
Dr. Hart, we're just about out of time, but just real quickly, can you tell me, can you expose yourself over time to foods that you might be intolerant to and build up a tolerance, yes or no?
Yeah, if you remove your foods from your diet for, a number of months, usually about 3 months from the diet, with food intolerance, you sometimes can tolerate those foods again, which is really good news.
Yeah.
The main thing is identifying the problem foods in the first place.
Okay. Very good. Dr. Gill Hart, good information this morning. Thank you.
Thank you, Gina.